Anxiety is normal. It's a normal part of life, and it's good for us to be anxious. It helps us prepare for things. It helps us stay out of danger. Pushing, being firm for them to go to school is probably the best decision. But if you're doing that and things are not getting better, then that's the time to seek help. Therapy is basically facing your fears. We call it exposure therapy, so you're exposing yourself to what you're afraid of. So if you're afraid of going to school, you need to practice going to school. If you're afraid of being away from your parents, you have to practice being away from your parents. And so what we do is help structure that, help the family break down frightening situations into small steps, give the kids and the parents the confidence that this is the right way to go, and support them as they stick with the plan, because it sometimes can take time and it can be rocky along the way. To make sure you understand why your child's being anxious, and that's the difference that I usually describe as the difference between anxiety versus stress. So by anxiety, meaning I'm overly anxious about something that's pretty safe. So I'm nervous about going to school just because I'm nervous about being away from my parents, and there's nothing particularly stressful or bad going on in my life. It's just a change, and I'm a little bit nervous, and it makes me anxious. Versus stress, when there actually is a problem that needs to be dealt with. So for example, if a child has a learning disability, I think support is probably the most important thing for parents. Having other parents who, friends, family, who can empathize, especially those that have had their kids already go off to college or have gone through this already, it can be comforting to talk to.